Hey, it's Shilpa Bharaskar here, and it's lovely to be here today. I'm really excited starting this new series of blogs on decoding cases of old and new masters using the stages template. Now, I promise this is going to be awesome, and I'm really excited for the lessons we'll be learning together. So, today I'll start with my favorite homeopathic practitioner of all times, Dr. Compton Burnett. And for those who don't know him, for me, he is the superstar of stage 1 homeopathy. Now, what is exactly stage 1? So, to simplify things, I've divided the homeopathic approaches, the landscape of homeopathy, into four specific approaches, right? And stage 1 is the types of approaches you use for patients when they present at stage 1, which is what we call a disease diagnosis. All right. So, all you have are common symptoms of a disease syndrome and just pathophysiology, diagnostic symptoms, and that's all. Investigation reports that a patient brings. And today we're going to decode a case by Dr. Burnett. And if you are familiar with Burnett, his strength for me is reversing pathological cases on the borderline of homeopathic medicine and surgery, or any medicine and surgery. And he resolves these pathologies using pure homeopathy. And today, I'm going to look at a case of cataract, a so-called surgical condition from his book, 50 Reasons to be a Homeopath. Now, if you've seen his cases, you know his cases just show a series of prescriptions, one after the other, that go on for 2 to 3 years until finally the patient resolves. Now, for the outsider, this is, weird. What sort of homeopathy is this? Series of, throwing remedies at random and finally the patient is cured. It's sort of unbelievable. However, if you understand the thought process behind it, you will realize the gems that we have in store for us. So what I'm going to do for you is I'm going to attempt and try and decode these prescriptions for you based on my research, my experience in the last 25 years, and I promise we will all grow and learn in the process. All right? Ready for it? Let's get it there. Okay, so this is the case by Burnett. I'll just read whatever he's given and then we'll go through my thought process. So Mrs. Wee, aged 66, came under my observation on May 20th, 1884. She came through a friend whose cataract had been cured by me with medicines. Now, this is the history. In November 1882 and in April 1883, she's been operated upon for cataract of the right eye. Inflammation set in and the eye was lost. Now her left eye has cataract. The lens had a grey look and her vision was impaired. She wears spectacles, but she cannot sew or thread a needle with their aid. Her father and his sister had a cataract. Patient's skin is scaly and pimply, more particularly that of the face. That is it. So this is stage 1 for you. And this is all he got. And let's see, how do we analyze whatever patchy information or so-called patchy information for the classical homeopath that we have here. So this is the totality that I take in, and this is what is important. The chief complaint, the left eye has cataract. That's what our main focus is. The lens has a gray look. The vision is impaired and she cannot sew or thread a needle. Now, the past history and the family history are very important when you're using stage 1 approaches. And in Burnett's case, it is more critical because this is where you will get your zoic remedies from. So she's been operated for cataract of the right eye. The inflammation has set in that eye and it's more or less not functional. But she's also got a family history of cataract. And there is what we call a pathological concomitant, which is very critical when you're using stage 1. Is there something associated along with that pathology? And in this case, the patient's skin was scaly and pimply on the face. And at her age, it was important. So that is where we have. So what did Burnett do? What was the first prescription he gave her? So here it is. He gave her sulfur 30, 5 drops in water, night and morning. Now, why sulfur? Of all the hundreds and thousands of remedies, why sulfur 30C? So this is what I've looked at. Now, if you look and check his book on curability of cataract, he writes, there is a very strong pathological homogeneity of the skin and the lens, which means there is a connection of skin problems with cataract. And even in the modern text and modern literature, we can see, I found one link for you. And this was an article I found in one of the journals in 1963, and it says cataracts associated with dermatological disorders. Literature on various dermatological disorders which are known to be associated with the formation of cataracts showed a number of syndromes or entities in which cutaneous manifestations play a major or minor role. Such cataracts may be congenital or acquired, and they could be resulting from a developmental, toxic, allergic, or metabolic factor, although the exact metabolism is unknown. So what it says is cataract is a complication of dermatological disorder, and it probably occurs more commonly than has been reported. And there is an awareness on part of dermatologists and ophthalmologists around this. So this is interesting because Burnett found the connection between cataracts and skin issues, and that's why he noted that the patient's skin was pimply. And this is what led him to start off with sulfur. And Richard Hughes, the manual of Richard Hughes or his Mitra Medica was the key textbook that Burnett used. And if you check in Richard Hughes, you will find that he mentions sulfur is used for cataracts when trouble dates from repercussions of a cutaneous eruptions. And just for interestingly, if we check cataract and eruption in Quest, which is where we repertorize from the Mitra Medica as well, you will see that sulfur and sorinum, these two head the list, which is not surprising. So lens cataract eruption after suppression, Nair has written about it. Herring has given a case as well where some sort of eruptions and cataracts were associated. So that is very, very strong in sulfur. It is the top remedy of all the thousands of remedies in our Mitra Medica. And that is what Burnett started his cases, almost, all his cases which have this combination of some form of dermatological condition along with eruptions. And let's see what happens. Since the last date I sent her a medicine, but omitted to note it, she thinks her sight is clearer. So obviously sulfur started doing something. No other information, and Burnett gives her calcarb 30C. Now, why calcarb? Of all things around, why calcarb? Now, if you go and read again his research and do some work there, in the same book of curability of cataract, he quotes Yar, who's written Hempel's translation. He says, I've so far accomplished the most for cataracts with sulfur, allowing the dose to act a long time. And if the action of sulfur seems exhausted, I then commonly resort to calcarb and next to Lyco with tolerable success. There's not much individualizing here. So this is like a protocol they follow. And the cyclical remedies, sulfur, calcarb, and lycopodium, they go and, chase each other and work in cycles, in just the way lots of different homeopaths have observed in practice. So for Burnett, after sulfur, calcarb is the cyclical remedy follows well. And he gave her calcarb, and let's see what she says. I'm thankful to say my sight keeps getting better, only I'm nervous and everything falling makes me jump. Now, there's nothing around the cataract. It's continuing to get better, but or the sight continuing to get better. We don't know about the pathology, but she says, I'm now nervous and makes me jumpy. And now he gives her Tuya 30. Now, why Tuya? Obviously, Tuya is one of the thousands of remedies for nervousness and making somebody jumpy. But if you study again the way Burnett approaches things, Tuya is his number one remedy for vaccine, any form of vaccination or vaccinosis, which is ill effects of vaccines. In her case, we do not know what is, whether she's been vaccinated or not vaccinated. There is no information. However, if you read Tuya, and he has a big book on just Tuya and vaccinosis, but if you just look at the clinical picture of Tuya, what he has seen is there is a syndrome of Tuya. There are some very specific Tuya symptoms which happen in people. And what he's found is acne of the face, the nose, and some form of nasal dermatitis with or without vaccinosis is very specific to Tuya. And that must be probably one of the reasons he wanted to just make sure that sticked, and he makes sure that all that skin element is taken care of, which is one of the things which has held this cataract in place. And so he uses Tuya. Now she comes back in December, and she says, I can feel my sight is improving. Now she's continuing to do well, but Burnett is giving her prescriptions. Most of these prescriptions are based on his protocol, but most of these prescriptions are what we call as zoic remedies or intercurrents. They're not specific organ remedies for cataract, or rather they have a concomitant going on along with them, which is a baseline factor. But this is like the first time he's used something which is a non-zoic remedy, and that is causticum. Causticum 100. Probably centesimal scale. So why causticum? Now, what at this point we're going to do is we're going to look at the top 10 remedies for cataract in Quest. All right. So I'm just going to go and check the top 10 remedies. I'm just going to clear this and look at cataract. Now, what Quest will do for us is it will get us the top remedies from all the 3,000-4,000 remedies that we have in our database. It's going to go and give us the top remedies from every possible place, from repertories, from Metromedica, and the ordering is based. Now, cataract has 140 remedies in incomplete, all right? Now, there are so many remedies in degree 4, which one is better than the other? This is the place which helps you note that, because in Quest, what also happens is that the number of authors who have denoted a remedy for its clinical curability, that remedy goes at the top. All right. And this is where we have silica, goes right at the top, sulfur, and the third remedy is causticum. So he's given sulfur, and sulfur is for most of his cases where you have a skin issue along with, or suppressed skin issue along with cataract. Silica, he's basically used for suppressed sweating or foot sweat. So these are his two top remedies in most of his cases. But right now, causticum is number 3. And I did not really, think of causticum for cataracts as one of the top 10 remedies, all right? So again, probably 2 factors: cataract of the left eye, which is what our focus is right now, cataract after injuries, and, it also follows sulfur well. So she comes back on the 1st of Jan and she says, I'm thankful to tell you my sight is much better. I can now see wonderfully well to read and write with spectacles on. And I can see very well to go about or do anything in the house without the spectacles. This is big, right? So he repeats causticum. So a remedy that's doing well. And, she's continuing to get better. And he repeats it after how many months? Probably December, a month. He repeats it after a month. All right. Now she comes in and says, I cannot bear the light so well. The eye which is blinded waters very much. So that inflamed eye, that other eye, is watery. And she's developed some sort of photophobia. This is what we call a new layer coming up here, and a new sort of inflammation of the eye coming up here. All right. Now, at this point, he chooses to give her Soranum 100. Now, this is another zoic remedy. Remember the top remedies for soric sort of state with cataract. One was sulfur and another was soranum. And again, if you check his books, he's written cataract is a soric manifestation, skin and mucous membrane are affected and itchy. So probably because the eye is watering and there is lacrimation, he thought it was a skin and a mucous membrane. It's a soric symptom coming up. And he says lens is nothing but differentiated skin. It's a dermoid epithelial structure anatomically, and it's a metastatic primitive soric expression. So that's why he gave Sora at this point. Now, she developed a bad cold and she comes to him in April. So that is 3 months or 4 months. We don't know what's happening with the eye, but right now she's come back with a bad cold. This is when he gives her Pulsatilla 1x. Very low potency, in fact, a mother tincture sort of a thing. And if you look into the top remedies, it does come up, in the first 10. And if you look at Pulsatilla, obviously it has, injuries and different types of cataracts going on here. But what you also look at is Richard Hughes' book, all right? Because that is so more or less Burnett's textbook. That book and Hale's Metramedica. These are two of his Metramedica for any form of organ pathology. And he writes cataract with any form of photophobia, catarrhal condition, and blenuria is when he's used Pulsatilla. If you look at clinical cases of cataract, this is what he's done. Whenever you have photophobia, catarrh, or blenuria, any form of mucous membrane discharge, he's used Pulsatilla. So it's like a pathological concomitant. If you have any form of eye inflammatory issue with cataract, he uses Pulsatilla. Just like he uses soranum or skin or a sulfur for skin issues, which is a pathological concomitant. And if you look at Richard Hughes' book, you'll find Pulsatilla has profuse mucus secretion during the night. So the eye keeps watering. And, check the Metramedica. Say, for example, if you look at Richard Hughes' Metramedica, and if you check Pulsatilla, you'll find there is headache with profuse secretion of tears, smarting in the eye, impossible to keep the eye open, profuse secretion of mucus in the eye, large secretion of mucus in the eyes, eyelids begin to smart and itch. So pathologically, Pulsatilla creates profuse mucus, blenuria within the eye, right? That was his reason. The patient comes in May, which is about a month later, and she says the left lens is decidedly less milky. She can see to thread a needle. So he repeats Pulsatilla again because Pulsatilla has worked positively here. And then she says, my eye is not so clear, again in July. This time he gives her silica. Now again, silica, as you've noticed, it's the top remedy of all the remedies in the Metramedica. Now, he would have just used it as a specific. We don't know, or probably because silica follows Pulsatilla. We have no idea why. There is no change. So the silica hasn't registered at all. So what he does, he goes back to causticum, which was the pathological remedy that had worked in the past. So for all the zoic remedies and the intercurrences used, causticum was the only pathological remedy that he's used based on injuries to the eye and focus on the left eye. And she sees better. She's much better again. So that pathological remedy, causticum, has worked. And so has Pulsatilla. So he repeats the causticum again. There's no further change by January, which is, this is next year, January. So about 3 months later, there is no change. So he repeats causticum. She says, no, there's no change. 3 months ago, what has happened has not changed. So causticum worked, it stagnated. He goes back to Pulsatilla. Now remember, causticum and Pulsatilla are the two pathological remedies which have worked. They stagnate, but they worked. So he's alternating them. May, she says, I'm much better. Vast improvement, can read, can write, can see well. There is now only the faintest opacity of the lens. And then there is this last follow-up in October. She says her vision continued to be in excellent state. She is now just on 70. So that was the case. You see here, one eye had been lost through the operation, and the cataract in the other eye has now been cured with homeopathy. Now, Burnett says, I do not say the lens at the center is as clear as yours or mine, but the cataract is gone. That little rest opacity does not affect the vision at all and is not of the nature of progressive cataract. So he stopped the cataract producing process in its track. And what is remaining, that obviously is a part of a non-curable state, but it is not something that's affecting our vision. And it is no longer cataract, but it stationary remains. And that was it. So basically all he did was used 2 or 3 zoic remedies, which is sulfur, calcarb, and thuya, and soranum, and then he basically alternated causticum and pulsatilla based on key pathological concomitants that came up while he was working on the cataract, and that is what did the job. So hope that helps. Okay, so if you have realized and look at all the cataract cases by Burnett, you will notice maximum cases which are cured have been by the top 10 remedies for cataract in Quest, and also a couple of zoic remedies, or what he calls the intercurrent or anti-miasmatic remedies, and they are sulfur and soranum. This is what I call the startup approach that I teach new practitioners in my urgent mentoring program. And what it means is you give strategically a combination of an organ remedy or a disease specific remedy along with intercurrents which are based on miasms. And if you use this approach, it's very powerful. Without having to go and look into those deep acting constitutional remedies, you can actually reverse pathologies using this powerful combo. So the idea at stage 4 is, even though these look very complicated, they are very simple. Don't overcomplicate. Use organ remedies, use pathological concomitants for choosing your indicated remedies, use zoic remedies or so-called intercurrents, and just build your ladder. And there could be 1 or 2 that go wrong. You can always course correct in the next step, and that's the beauty of the game. So I hope you liked watching this as much as I've liked making this for you and decoding it for you. And if you would like know anyone who will find this helpful, please share this link, this page with them. They don't need to log in to watch this, but it will greatly help anyone's homeopathic journey. And I will see you next time with another interesting master as we decode their successful approaches, and let's go and give the best of homeopathy to our clients. Thank you very much. See you next time.